Smita Kumar and you're watching Medicircle. Today at Rendezvous with Smita Kumar section, we have a Dubai-based healthcare entrepreneur, Mr. Vivek Shukla. From starting with leading a family-run 30-bed hospital to lead the marketing team of Aster DM Healthcare Group with 350 medical establishments across 8 countries. He has really come a long way. Presently partnering at RSM Healthcare, he has also worked at Frost & Sullivan and has been helping healthcare providers engineer growth in revenue, profits, and market share since 1998. Hi, Vivek. Welcome to our show.
Hi. Glad to be here. Thank you for inviting me.
Thanks. So to begin with, how does RSM Healthcare AE provides high impact, long lasting business growth offerings to healthcare organizations?
RSM is, we work on 2 areas within healthcare. So we work on growth. And when I say growth, we work on organic growth and inorganic growth. And we support our clients, which are mostly hospitals. We support them in growing organically or inorganically. So we can help them in revenue enhancement, margin enhancement, new acquisitions, new market entry strategies. So we help them, basically we help them in growth, either organically or inorganically.
That's good. And how does RSM envisage a unique and effective approach to enable healthcare?
That's a good question. I mean, we have a very unique approach in the sense that we look at growth not only in terms of strategy, only in terms of planning, but we also extend our complete support in execution and implementation of the strategy and plans that we make. So we kind of roll up our sleeves and we get down to implementation with the client teams to make sure that the growth projections that we have suggested and the growth plans that we have suggested are actually implemented. That's one. The other thing is we use a lot of, we imbibe a lot of technology in our growth solutions. So to give you an example, for example, if we do a manpower planning for a hospital. So when we plan the manpower, it's not just doing the manpower planning on an Excel sheet or a PowerPoint. We also create a technology tool for them so that they can use this small software or a tool, whatever we create, to kind of do manpower planning for themselves on their own, even when we are gone from there. Or if we do a revenue projection for somebody, or we do a report in which we are projecting revenues and patient footfalls and some things like that, we will give them a technology digital tool which will help them predict using various algorithms and sort of an AI tool which will help them predict these numbers on patients and revenues on their own. So we're not just doing a written report or a project report and giving it to them. We are giving them, along with the report, we give them technology digital solutions because that's what clients nowadays need. I think the days when people were really impressed by fancy PowerPoint slides and project reports, those days are gone. Now people want actual implementation and they want to actually do it on the ground, right? And this is a digital world, so they want solutions which can enable them to fulfill on those plans and on those strategies that are being created. So that's the unique thing about RSM. So we help in implementation and we do a lot of infusion of technology into our solutions, into our strategies and plans.
That's good. RSM's effective approach was ranked among top 10 healthcare consulting firms in the United States in the year 2019 by Modern Healthcare. So how does that make you feel?
Yeah, that makes us feel really proud. Yeah, I mean, that makes us feel really proud. We've done in the US a lot of work. We have a client list of more than 5,000 healthcare clients in the US. RSM in US works with all the big names, including the Clevelands and the Mayos and others. We support our clients in that part of the world mostly in growth through acquisition. So we have a very strong mergers and acquisitions transaction advisory services in the US, and we also have a very strong technology solutions consulting as well. So we help a lot in strategy, in growth, as well as technology. And yeah, so it really makes us feel proud and happy.
And as we all know that RSM has a strong presence in the GCC, including 3 offices in UAE, in Dubai, Abu Dhabi, and Sharjah. So how has been the journey till here?
Journey has been good. We all know we are going through, the whole world is going through a difficult time this year. Yet, fortunately for us, we've been able to make some good initial inroads into the Middle Eastern GCC markets. We have done projects and we've helped clients in UAE. We've helped clients in Saudi. And also we've done some bit of work in Bahrain. So we've done some work in this region. This has been a good journey so far. The good thing is that I myself have been in this region for last 8 years now. So, and even in my previous company, in my previous job, when I was working previously, I was supporting a lot of hospitals and healthcare clients. So, so that network is still there, and those connections are still there. So that is a big help. In spite of a difficult year, we've done well so far this year. So it is okay so far. It's been fine. And I'm sure, of being a very optimistic person, I think that things will become better from here, and we will see an end to the pandemic and an end to all this thing that's going on very soon. And hopefully we will be back into the fast lane very soon.
Yes, optimism is really, really required, because we all thought that COVID is here to go, but it is like here to stay, and we just need to live. We have to start living with the pandemic and start stay forward and everything. We have to fight back and keep the pace up.
Yes, absolutely, absolutely. You have to stay safe, stay protected, and also continue to live and continue to to move forward.
True, very true. So any personal views or comments you would like to share with our viewers?
No, I think the personal views in the sense that, one is that we, in this modern context in today's world, healthcare is a very, very important industry for more than one reason, right? So there's a huge role that the frontline staff and frontline doctors and nurses and all the other people in the hospitals have played. There are people who have been working overtime, saving lives, contributing. So healthcare has definitely been in the center of focus for the last many months. And now the world looks at healthcare very differently. How healthcare is provided is changing, and it has really changed in the last few months also. So we know that things will not be the same in healthcare. The way hospitals are designed, for example, probably will not be the same again, because hospitals will be designed in future keeping in mind that if there's a pandemic, you need like watertight segregation between the infected patients and the other elective patients, so that the operations continue. So that's one thing which will happen in healthcare. There is a lot of focus on remote monitoring, on teleconsultations, on virtual health, so to speak. So some people call it eHealth, some people call it telehealth, some people call it virtual health. But eHealth, virtual health, whatever it is, there is a renewed. There was always focus on it, but now it's become really important, and people have realized that this is going to be the next thing. So this is another development that has happened. We've also seen in healthcare that there is going to be a lot of pressure on costs. From a business standpoint, revenues in hospitals have not been as much, because elective surgeries and other surgeries were not taking place. Mostly hospitals have been dealing with COVID patients. So in many countries. So so that's going to put a lot of pressure on costs, on operational efficiencies. So you will have a lot of rethinking that needs to be done in how hospitals will have to stay viable from a business standpoint. So these are some of the challenges which are coming up. So it's a mixed bag. There are challenges in running hospitals and profitability. There are challenges in maintaining workforce, keeping them healthy, keeping them motivated. There are challenges in terms of costs. There are challenges in terms of revenues, and keeping everything in place. There is also some opportunities in telehealth and remote monitoring. There is opportunities in some pockets as well. So it's a mixed bag. There are challenges, there are opportunities. But as I said, we need to stay optimistic and look for a bright future.
So thank you a lot. Thanks so much for sharing your insightful views at our healthcare news portal, Medicircle. Thanks.
Thank you, Samita. It was great being with you, and a pleasure, meeting you today and speaking to you.